Welcome back, everybody. Thank you for tuning in. I've got a very serious conversation to have with you, and that is the age that people are having strokes at is getting younger and younger. I work at a major hospital, and we are known for being a major hub for people to come for their stroke care. So one of the major things that I'm starting to see, and it is totally avoidable, is the fact that a lot of people are having strokes at younger ages. For example, in England, just from 10 years ago, the average age of people for men has gone down from 74 to 68, and for women it's gone down from 75 to 73 just in 10 years. On top of that, this is also England data. The amount of people who are having strokes between the ages 40 to 69 has gone up to 38% from 33% in just 10 years. And it's crazy to me because these are things that I'm seeing. I am seeing patients having strokes at 30 years old, 33 years old. I'm seeing heart attacks at 30 years old. What's going on? What's going on? This stuff never used to happen in generations before us. When my parents were our age, we didn't have all the we didn't have all the diabetes, we didn't have all the cancer, we didn't have all the strokes going on. And this is tons of money floating around that everyone's grabbing at. And that's why this information isn't out there, how you can prevent these strokes, how you can take care of these things, even post-traumatically with natural things to make sure that you are getting proper blood flow. And I've seen people fully recover from strokes. And the most important thing to remember is that we need to look at prevention of these things, because the worst thing to do is to have a stroke or have a bleed where your blood vessels become so brittle and so weak that you have a bleed in your brain and you have a stroke on top of that. And we don't find out until after the fact, once we get the brain to settle down and the blood out of the brain, to find out if there's any dead tissue or not. And that's essentially what a stroke is. When we've cut off the blood supply somewhere from the heart to the brain, and it's going to cut off or reduce the amount of blood flow, and we're going to be left with dead brain tissue. And so you can die from that. You can have very subtle, you might never know somebody ever had a stroke, or a TIA, which is short-term, 3-letter acronym for something that just means that they blocked off blood flow for just a short amount of time, and it's usually resolved on its own by the body. Another sign that the body is just miraculous, and it knows how to take care of itself and try to protect itself. So one thing that we can look at is the face, the arms, the speech, and the time. Fast, okay? So when we're looking at people who we think is having a stroke, look at the face. Is one side drooped? Is the other side drooped? Have them smile. Is one side... Another thing is eyes. These are all major signs for the face. For the arms, strength. We can have people... You can hold resistance and tell people, and same with the feet. You can tell people to push up, to push down, and you can see if strength is even on both sides. As I said, both with the legs. You can hold people's legs, or say these are the tops of the feet. You can say push up as if you're pushing up on the gas pedal, and you can put your hand underneath and say press down on my hand as if you are pressing down on the gas pedal, and measure with your own abilities if sides are equal as far as pressure. So another thing is speech. Are they aphasic? Can they not talk at all? We see people coming with stroke who literally we're talking 1 minute, they're having dinner with their family, and literally they just go blank and they can't talk. And that's the worst, because we can't communicate with them properly to see what other signs and symptoms they're having, and it's on us within a very, very quick time period to find out what other types of deficits, what other things are going on within the body, so that way we can treat that properly. And the last one, which I have the most role in being a CAT scan and CT technologist, is time. The amount of time before you have dead brain tissue or ischemic brain tissue, where you just have a lack of blood supply, it's not very long. If you don't get treatment within a couple of hours, you can have that dead brain tissue for the rest of your life. And because of that, you might not be able to use half your body. You might not be able to use just a pinky. You might be able to slur your speech. You might have some memory problems. It depends where that blood supply has been cut off and how long it's been cut off. And of course your overall nutrition and things like that. Where if you had a stroke, typically you have not so good lifestyle choices, you have not so good nutrition in the first place. So again, it's up to the body's recovery ability to determine how well you're going to come out of that on the other end. So the 3 things that I see, my own experience, is that are related to strokes is high cholesterol. We have hypertension, which is high blood pressure, and we have obesity. And that's something that no one is telling and talking to these patients about is, guys, these symptoms are all usually secondary to diabetics. When I see someone who has diabetes, 9 out of 10 people also have high blood pressure. When I see diabetes, 9 out of 10 are also overweight. When I see diabetes, 9 out of 10 also have high cholesterol values. So I'm young, and not so long ago, physicians used to have conversations with their patients. They used to say, I remember hearing this, even as a student, orthopedic surgeons would tell patients, you need to lose 100 pounds before I'm even going to operate on you. This is why you're having some pain in your knees. I can replace your knee, yeah, because you've had gravity over 50 years and you've been 300 pounds overweight for all this time. But even then, it's a waste for me in time, and it's a waste for you for money. These are real conversations that were being had. And don't think that I'm knocking on physicians for that. They're very well intended, and they definitely know their stuff. But at the same time, it's only one track of healthcare, and we need to keep an open mind moving forward, because as soon as we shut off our minds to new information, it's over. We're done learning for the rest of our lives. And if our brains were designed to do that, then they would shut off after school or whenever you were done with that part of your life. So anyways, it's usually caused by poor lifestyle choices, lack of exercise, and eating habits. All three things that don't get talked about to patients within the hospital. These are all things that you can do at home. Work on your lifestyle choices, get moving, get exercise, get excited about something, and just start eating better. And it's sad that some people think that they're eating better and they're eating cleaner, and some people really do, and they still struggle with certain signs and symptoms, and that might be related to toxin buildup in your body. Everyone's very individualized with their care, but without getting off track, those are some major things that we need to consider, and that we need to have a talk with, a real discussion, and sit down and tell people. And some people don't want to hear it, and some people do. And most people do want to hear it, because they feel lost. They feel wrongly done by the medical system, because they keep coming back for the same problems. And all we're doing by giving them insulin or giving them cholesterol medication or stapling their stomach because they were overweight for so long and they couldn't lose it, these are all symptomatic treatments. These are all not looking at what caused those in the first place. Because if I give you insulin for your blood sugar, yes, you're going to have a decreased blood sugar. But what's causing that process in the first place, that is what scares me, because that is still what's going on inside the body, and that it's still going on and it's going rampant. Even though we're looking, it's like a magician. Look what's going on over here. Okay, you have high blood sugar. Okay, we're going to treat it. Let's get down. But guess what's going on over here? This is what caused that in the first place. And we're not having that conversation with the patient to get that cholesterol down naturally, to get that blood sugar down naturally, and get rid of it. Because if we look at what's causing that in the first place and take care of the root problem and not just the symptom with something synthetic, without something that's going to be more side effects, and on top of that, most of these things are going to be more cost effective for you, and you don't even have to leave the house to take care of these things. Save your time, save your money, save your health insurance premiums, and you're going to feel better too. So anyways, I just want to talk about some things that really scares me, because I'm starting to see so many young people with heart attacks and specifically strokes. They're essentially the same thing, guys. And on top of that, if you have blood vessel problems, if you have a clot somewhere in your body, just where the blood clot ended up. It could be in your lungs, it could be in your heart, it could be in your brain, and we're going to cut off blood supply to that certain part of the body. And that's what scares me. And that's a tip to me in another conversation, not for this video though, but just for your own knowledge. If you have a stroke, or if you have your blood vessels, your carotids that provide the blood flow to the brain and the nutrient supply to the brain, if those are so blocked up that you need surgery, is what most people opt in for, and sometimes that's needed because we don't know how to take care of that naturally. But without getting off topic, that is a major sign. If you have blood vessel blockage here or in your brain, guys, we forget that our body's all connected. Your blood vessels are going to be suffering elsewhere in your body, so you could have blood clots. Now, because you're a stroke victim or a heart attack victim, you're also at risk for one or the opposite, or more blood clots, more factors, including ischemic tissue or blood supply cut off to the rest of your body. And that's when things get scary. You can cut off blood supply to your legs, you can cut off blood supply to your gut, and I mean, even just certain organs can have blood supply cut off. And then you really start going down a rabbit hole, because now we're chasing after these signs and symptoms yet again. So without further ado, thanks for watching this video. I want to tell you guys what's really going on inside the hospital, what I see every day, and how important it is to get your family member or yourself. If you start to feel odd, here's a couple quick tricks on how to really quickly and how to use that FAST system. Remember, face, arms, speech, and time. That way you can get with that person and really know what's going on and decide if you need to make that call to 911 or to get that person in the emergency room for that stroke care. All right, guys, thanks for watching. As always, protect yourselves and protect yourselves. I'll see you on the next one.